Good evening. My name is Dale Oliva, and today we'll be going over gait analysis throughout the entire lifespan. So the overview, here's what we'll be talking about today, and essentially we're going to start off with adult gait. And the reason why we're going to start off with adult gait is for the fact that having an understanding of how the adult gait is normally executed and studied can reveal any abnormalities in infantile or elderly gait. So when you do an observation plan, you can look at a normal, healthy adult gait and begin to notice the minute differences, perhaps even major differences, in the normal adult gait versus any other type of gait analysis that you may do. So overall, starting with adult gait, as you can see right here, it's broken out into phases. And the adult gait essentially begins with heel strike, which is going to be the initial contact. And overall, as you can see later on, you can see the midway point, which is terminal stance, and all the way with the terminal swing. But overall, some important concepts with this I want to go over with you today is the double support. And the double support is essentially when this can have 2 points of contact, a double support, if you will, in which the body is making 2 contacts at the same time. This will help increase stability of walking. You'll notice that this is perhaps going to differ from the 10% you can see right here from the normal adult gait, and you can see some differences with gait abnormalities or development later on in life. Also, I want to point out the phenomenon of pendulum swing. Now, pendulum swing essentially is when the leg moves forward to back, kind of like a pendulum, if you will. It doesn't just occur in the leg, it also occurs in the arms as well. With adult gait, there is a few trends in which the sagittal plane joint moments were more repeatable than frontal or transverse plane moments, says Kadapa. And now what that means is that overall, the more times gait was analyzed by observation plans, they noticed that the more often than not, the most repeated motion throughout various different types of studies was the fact that sagittal, which is essentially like leg extension or flexion, occurred the most. And they had the least amount of variables, if you will. So the most repeatable behavior was consistent in the sagittal plane. Now, there are indeed some possibilities in which gait can be abnormal, even into adult life. It can be caused by disease such as scoliosis or any type of anatomical. It can also be psychosocial. And one possibility of any types of abnormalities when it comes to the development of human motor movement is causal attributions, which is reasons to which people credit their successes or failures, and also differs with amounts of self-esteem with that individual. And it can cause a lifetime of development of tissues as well as execution. Now, when I say tissues, essentially that the less probability to participate in sports and exercise, and that's important for the fact that over a lifetime, tissues, especially muscular tissue, will not have the opportunity as others who are more active to actually develop and become more hypertrophied and develop more fibers. Also, when it comes to examining various different types of gait, there are observation plans which allow specialists to identify levels of steps to correlate level of development. Now, the step 1 is going to be the earliest levels of development, always the most advanced, which increases in numerical value. Now here for adult gait, as you can see right here, when you look at the video provided, you'll see some normal arm swing, normal leg swing, as well as good execution of leg movements to have some of that pendulum swing motion I was talking about, as well as good heel strike, and essentially overall the very minimal amount of abnormalities that were noted in this particular video of adult gait. So now that we actually have a good understanding of how adult gait is executed and the various different types of phases and what to look out for, and understanding how the analysis works, we're going to go into early walking. Early walking is essentially going to be for the first 7 months or so, is when about the average of when infants begin to walk. And there's going to be some common trends with this. There's going to be a low stride length, double knee locking patterns, high guard arms up, as well as leg extension and out toeing. As you see right here, the child as in the picture to the right has a high guard stance, if you will, in which they uses the arms to actually help make their body more stable and helps out with balance. You will not notice this with the adult because this is going to be some of the early developments of walking. Also, leg extension. Normally, the leg will extend forward, very minimal lateral movements. But in this case, you can see with the child, the leg is extended, but not in the fashion that you'll see with normal adult gait. And also, you have something called out toeing, in which the toes or the foot is essentially not going to be moved in the sagittal plane. Essentially, it's going to move in various different planes, such as the frontal plane. So as you can see right there, is going to be a little bit of an angle when it comes to the walking pattern in this infant. Now, something I also want to point out when you watch this video, this behavior is not always repeated. So with adult gait, you can see more repeated behavior when it comes to walking, a little bit more standard. But when it comes to developmental gait analysis, when it comes to children, it can differ quite significantly. So some of the studies that were done on the early walking gait, the knees and hips, when it comes to children, the knees and hips are flexed throughout the gait cycle. The mean stance, phase time, and double support time were 4 and 15% greater than adult gait. Now remember, in the phases of gait, the adult gait had anywhere from about 10%, 20% overall when it came to that double support. And you'll see with some of the early walking for infants, you'll see that this is actually increasing from 4 to 15% more on average versus adult gait. And the reason why the theory behind this is there's more time spent on stability versus frequency. Overall, the neurological tissues, if you will, the neuromuscular tissues are still developing in order to actually master the art of walking when it comes to children, because they haven't quite got a grasp on it yet. Also, we show how the step-to-step transition and unavoidable energetic consequences of the inverted pendulum gait can give us a right prediction that are experimentally testable on humans and machines. When you actually watch this video when it comes to the infant, you will not see any type of consistent arm and leg swing at all. Essentially, the child still has the arms up stance, if you will. Children are less likely to begin using the pendulum swing with gait. This is not something that's going to be a repeated behavior, if you will, it can be noted. Deficiencies can be not, if and when children begin to use this swing. So essentially, I kind of wrote that funny, but what I'm trying to say there is that yes, even though you will not see leg and arm swing with normal adult gait in this stage of gait analysis, that's not to say that there's an abnormality in the child. The child is still developing, learning how to walk. And to observe this behavior is essentially expected, and also it's normal to observe this type of high guard arm stance in this age of that child's lifespan when it comes to the gait analysis. But overall, the observation plan should always incorporate the pendulum swing just to make sure that's being duly noted and documented. So the next one is going to be the toddler, a little bit more advanced in age. And for this one right here is a little older than the first gait analysis patient that we saw with the baby, but this one's going to be a toddler, a little bit older, anywhere from 2 to 5 years in age. And we'll go over some things that we observed from this. There's going to be a lack of flat foot on the floor. As you can see right here, the patient essentially has a plantar flexion type pattern with each step that she takes. On top of this is going to be a lack of arm swing with the movement of the legs. Usually as the left leg essentially extends, the right arm will go posterior of the body. Essentially, you're looking for these sagittal type movements when you do this type of gait analysis to see if that's been observed and documented. as the patient gets older, these types of patterns when compared to the normal adult gait should be more observed more often. So it could indicate the deficiencies, which I'll go over here in a bit. Also, there was improper heel strike, most likely due to that plantar flexion of the feet, less leg extension, and less stride length as well. So when it comes to early development of gait, when it comes to children, you'll notice that stride length is very, very short compared to adults. So they did some analysis on gait when it came to children. The 3D lower limb gait analysis showed high levels of repeatable and sagittal plane measures, like we talked about earlier. 3D analysis of shoulder and elbow flexion extension during these two functional tasks, head to toe and head to mouth, was highly repeatable between sessions. Now, in this case, when I observed this patient, a lot of the sagittal movements of the lower limbs were not essentially repeated behavior. It was very erratic, and not too many things were actually repeated on each stride that was taken during the gait analysis. So this right here, you can start documenting some of those abnormalities that I was talking about earlier. Also, the gait analysis helped me look into something a little bit more as well. Now, when it comes to these types of gait analysis, I began to realize that her walking pattern seemed very, very familiar with that of the fact that patients with cerebral palsy. Now, I provided a YouTube link, but essentially with cerebral palsy, if you look at the feet, there is no exact heel strike with the calcaneus. It's expected to see the calcaneus with heel strike when you begin the normal adult gait, but in this case, in both patients, it was not observed. Something to actually look out for, and it could be an indication of a possible disease or abnormality when it comes to gait for that particular patient. Now, I am no way, shape, or form a medical doctor, but this is something to observe and actually bring up to the primary care physician of that patient later on in life to actually get a good diagnosis of what is going on. And in further details of this type of anomalies, a co-activation of antagonistic leg muscles during the stance phase up to the age of 4 years, large solitary biphasic potentials and gastrocnemius with segmental latency after the muscle was stretched as the forefoot reached the ground. Overall, fancy words for this type of leg movement is observed in cerebral palsy patients. Now, as you can see right here, the same type of pattern behavior can be seen with the original toddler from the original video. So now finally moving into elderly gait. Overall, here's some trends you can see with elderly gait, especially with the observed observation plan with this particular patient. There was decreased stride lengths. There was irregular arm swing. The right arm hardly had any swing when it came perpendicular with that particular leg swing, if you will. And also the posture. The posture of this individual, I could not tell. Essentially, the patient is obviously postmenopausal. But with that being said, there could be indications of osteoporosis or bone tissue abnormalities that could affect the posture, the joint movements, range of motion, various different types of disease that could possibly be influencing this patient. So when you do elderly gait analysis, it's good to have knowledge of the different types of disease that patient may experience in their lifetime, so you can better understand their posture and their gait analysis and why they're doing the things that they do. Reduced stride length, reduced speed, increased double support time, and poor clinical gait scores were associated with fear but show little evidence of independent association with falling. What that means is essentially that many older patients have a fear of falling, which goes into the psychosocial influences on gait, especially with elderly patients. And why you may think that's important? Falls associated with tripping over an obstacle can be devastating to elderly individuals. So yes, falling is indeed bad, and it can have catastrophic ailments to any patient, especially elderly, that may have experienced this type of unfortunate event. To continue, yet little is known about the strategies used for stepping over obstacles by either old or young adults. Old adults exhibit a significantly more conservative strategy when crossing obstacles with slower crossing speed, shorter step length, and shorter obstacle heel strike distance. And you can notice that all of these were apparent in this particular patient when it came to observing this video. And lastly, the young mostly responded, now this study actually compared the gait analysis of adults versus older patients. The young mostly responded by taking a single step, whereas the old mostly responded by taking multiple steps. As observed, the stride length was very, very small in that patient. The steps were taken by the old compared to those of the young, and were significantly shorter and had significantly smaller heights. I'm taking significantly earlier in the response, so it says Lucci's. Now you may see the life alert. It's a funny commercial, right? But when you actually begin to understand the gait analysis, the psychosocial influences, and the devastation that fall may have, as a health professional, now you begin to realize that this isn't quite a funny commercial. It actually could be devastating to a patient. And observing these different types of psychosocial influences, the studies show that the fear of failure is what most influence the gait abnormalities compared to adult gait when it comes to elderly patients. But overall, what I want to go over with you when it comes to all this is essentially that psychosocial gait analysis and finding abnormalities in your patient can lead to clues of disease. It can lead to psychosocial events. It can also lead to overall underdevelopment of different types of executed moves to include gait analysis, jumping, and whatnot. And that's important for the fact that you can begin to figure out what is wrong with the patient, what is influencing them. Is it actually anatomical disease, physiological ailments, or just underdeveloped tissues, or in some cases, overdeveloped tissues. So when you look at your patient and notice these types of minute abnormalities in their gait, it's important to realize that what could be causing it, why is this happening, and can further help you diagnose that patient to figure out a good plan to keep them on track to physical therapy and to actually begin to help them out later on in life. So with that being said, I hope you enjoy the briefing of the gait analysis throughout the lifespan, and go Lancers!